Hello, Dr. Stein. Hello, everyone. This is about a report case about autoimmune Parkinsonism. So, the patient is a 69-year-old right-handed male. He presented in our clinic the first time in January of 2024, but the story of his disease started long ago. In 1996, when he was about 40 years, he noticed cogwheel rigidity on both hands, and on 2005, an intense whole body shaking episode happened. And then 2 years later, he had trouble starting the movement and starting a dance. And he had also an episode of facial redness and followed by voice disappearance during the speech. In 2008, he had bouts of tremor, intense tremor, more on the right side and more when he was laying down. That carbidopa-levodopa was started. However, it increased the tremors. And he also had myoclonus on right upper limb. And the CT of the brain was done and only had a pituitary right cleft cyst. The next year, he noticed atrophy on both hands, mainly on the thumb and the dorsal interossei muscles. And also he had severe hypotension episodes. On 2011, he had daily functioning was declining, such as changing his own clothes and eating by himself. Also had apraxia. He had difficulties using the phone, and also autotopagnosia. He had difficulties in localizing the parts of his body in space. Also, he had swallowing difficulties, paratonic rigidity on upper extremities, and attacks of sudden immobility. In 2012, many trials with antidepressant were made, but the tremors only got worse. In 2019, he had fluctuating diplopia and blepharospasm, and he also had DBS implanted bilaterally. During the surgery, the tremors disappeared immediately, but also the other symptoms remained. And also he stopped using carbidopa-levodopa. In 2020, he had weakness and tremor on tongue and started having hypersalivation. On 2021, also he had sudden immobility attacks, and on 2021, he had numerous falls, and the DBS settings were changed. In 2023, laboratory tests were done, and antidopamine receptor D1 was elevated, was 1 to 8,000, and the reference value is between 500 and 2,000. But other antibodies were normal, and the DBS was turned off because the patient started using it and then started to run and couldn't stop it, and he had numerous falls. On 2024, she started methylprednisolone, and all the symptoms were improved or disappeared. So in January, it's the first visit with Dr. Bernard, and the treatment with corticosteroids were started. In March, he had 20 milligrams per day initially, and then the dose was being diminished gradually. He had an important improvement. He could also play tennis and table tennis, could dress by himself, and no hypophonia, hypomimia, all the symptoms disappeared. In June, methylprednisolone was prescribed for 2 weeks more, but on third day of the medication, patient had crisis, adrenal crisis with hypertension, muscle weakness, swallowing difficulties, nystagmus, horizontal nystagmus in any direction, dizziness, and also tremor in his whole body. And on July, he started 15 milligrams with hydrocortisone prescribed by the endocrinologist. And the tremors on the last visit that we saw him, the tremors were still remaining less, but still remaining more on the right side. He had mask-like face rigidity, cogwheel rigidity, hypophonia, slow speech, and balance disturbance. The next type that Dr. Bernard is proposing is to use IVIG. And that's what. Thank you.
One second. Let me stop this. Stop recording.